Hi, I'm Hal David Martin here at the Hip Preservation Center, Baylor University Medical Center, and we're going to talk about how to do the specifics of lateral-based hip rehabilitation, or some of the areas that we have to be particularly careful of, the things we can do and the things we should not do with a glute medius, a glute minimus repair, or an IT band release. So with that being said, Kara's going to help us here to demonstrate that. So first, let's just talk about how can you raise out of a chair. You can raise out of a chair. We're going to play like she has an operative leg on the left side and the non-operative leg is on the right. So what we're going to have her do is put all the weight on the right side and lift up. She can put weight on this, but not any to push up because we've repaired the muscles on the outside of the hip. And the same thing's true when we sit down. We use this as a jack. We grab the handle and then lower and raise, putting all the weight on the right side and not any weight on the left. So try that again. We put the weight up. You can put your foot down. We don't want to pick it up. We want to leave it on the ground. But we use this as more like a jack to raise and to lower. Okay, the same thing is true when we go up and down stairs. So we put the crutches, if this is the banister on this side, the crutches go on this arm, okay? And we go up with the good. So we'll have her step. We got crutches here. We got a crutch there. And we step up with the good leg like a jack and leave that one down. You can put the left one down. There you go. And that's the way we go up. So it's up with the good leg. And then when we go down, we do just the opposite. We go down with the bad. So you lower this and lower this leg, kind of lower it down and put your left leg forward and lower it down. There you go. Perfect. Okay, let's try that again. So now you're back up. So you're just going to use this as the jack. The left leg goes forward and you lower it down and to go down the steps. And that way we protect the muscle that's been repaired. One of the things that we want to always do, besides the 20 circles, so we do our 20 circles twice a day here for that. But whenever we get non-tender over here on this side, we can start into some maximus strengthening. And this is a critical factor in rehab for glute medius or minimus repair, that we don't strengthen any of the outside of the hip, the minimus or the medius, before the maximus is strengthened. So roll to your right hip. And we'll want to check and make sure it's not tender. And if it's not tender, then we can start to strengthen the maximus. And we do that by keeping the knee straight. And we come up and we squeeze. Here, squeeze 1, 2, and back down 1, 2. And back up 1, 2, and back down 1, 2. If we're too tender to do it in that position, we can always do it on our hands and knees. And let's get on our hands and knees. And then we come straight back with this one and hold 2 counts. And then back down 2 counts. Back up 1, 2 counts, turn your foot out a little bit, and then back down 2 counts. So we keep this maximus muscle rehabbed, and that's the one we want to rehab first before we start to activate and try to get the medius going by activating to the side. So we don't do that until we have perfect strength on the maximus. Okay? Let me show them what perfect strength looks like. Lay on your right side. Perfect strength is this. Lift this up and hold me up now. Okay, you ready? I'm going to push really hard. Okay, that's perfect strength. It needs to be 5 out of 5, holding the weight. Then we can go from there. But this is how you strengthen the medius. That's with the IT band released, and then you can start to strengthen the medius after the maximus has been completely strengthened and we have no pain in this area. And then finally, the overstretch for this area is the shoulder back and the leg over, and that'll help to kind of stretch that gently. And we want to do that only if it's non-tender, and we can stretch the tensor portion to the posterior aspect, and if we have a contraction of the medius, it's here. So that's what we do for the lateral base hip pain. In addition to just the triangles and strengthening, we do the core, and those are the most important aspects for lateral base repair.